about that part.
Never what?
All right, thank you. So this is Senate Health and Welfare. We are back on March 9th, and we are looking at S-197 with our Legislative Council. Clyde, this is great to see you again. So why don't you take us through the latest strike all draft?
Sure.
197.
Sure. So good morning, Peter Glenn, Office of Legislative Council. We're looking at draft 3.1. And I've tried to highlight the changes in yellow so we can kind of track where
And
the,
there's one thing I'm going to ask because the sound is so different in here. Just speak
very loudly.
as loudly as you can.
Okay.
Your teacher the microphones, because I've got committee members that turn their back to the table.
Yeah.
And I don't know if the microphones are on the screen or
Yeah. That's
I think it's right here.
they're right there. So they're with the camera.
I think they're sensitive. When I was online, I could hear pretty well. But if somebody who's,
Well, I'm thinking where the thing is on the side,
turn your back.
they have to turn their back to see the witness.
Oh, I see.
Okay.
Regardless, I will try to speak very loudly.
Oh, this is good. That's a good volume.
Okay. So the first section of the bill has not changed. This asks the Department of Mental Health in consultation with AOE and AHS and the Department of Public Service to conduct an inventory of all mental health crisis response programs that utilize state funds. And that would come to the committees of jurisdiction by January 15th of 2023. There have been changes to the next section. So if you remember in section 2, there is language about using ESSER funds to offer grants to after-school programming. And this language has been expanded to also include programming, mental health programming that's currently happening in schools. And you'll see that is reflected in the title. And
Just to make a comment about the dollars and the ESSER funding, this really does belong in the Education Committee. So our goal is to kind of look at what the policy is here in terms of helping kids' mental health, and then the education is going to be working on this as well.
So in subsection A, this appropriates $4 million in fiscal year 23 from ESSER funds to the Agency of Education, which is to work collaboratively with DMH to establish and administer a 2-year program that ensures continuous support to children and youth in school and after-school settings by providing grants to expand existing school-based counseling services provided by designated and specialized service agencies in underserved districts of the state, to develop either school-based or community-based after-school programs operating in a variety of settings outside the school day and over the summer, including before and after school, in-service days, and school vacation week, that support mental health and wellness needs of students, families, and staff. So now we're sort of expanding what the grants are available to. Then subsection B, the agency, it had been the department, now the agency is believed, is to adopt policies, procedures, and guidelines for the implementation of this program. Subsection C, the agency is to issue grants to in-school counseling programs and after-school programs in geographically diverse regions of the state on a first-come, first-served basis until the funds are depleted. When the applicant meets all of the eligibility criteria listed in subdivision 1 that we'll look at next, and at least one eligibility criterion listed in subdivision 2. So all potential grantees have to meet the items in list 1. First, A, at the top of page 3, the applicant uses evidence-based strategies to address students' social, emotional, mental health, and wellness needs. B, the applicant collects data to demonstrate the effectiveness of the mental health and wellness supports and interventions utilized in the program. And C, the applicant connects to and aligns with state and statewide initiatives, including Building Flourishing Communities, Youth Thrive, and the Vermont Youth Project. And then in subdivision 2 on line 8, these are additional eligibility criteria, and only one has to be met. So in A, the applicant works in close partnership with classroom teachers and school guidance counselors to coordinate supports, communication, and strategies. The applicant uses specially trained staff to provide one-on-one and small group supports and resilience sessions for children and youth, including addressing specific needs, such as suicide prevention, social isolation, anxiety, and substance use. The applicant provides participating families with assistance in navigating behavioral health resources in their communities. D, the applicant provides opportunities for children and youth to participate in activities that heal and prevent social isolation, such as outdoor activities, art therapy, recreation, and time in nature. E, the applicant consults with local pediatricians to provide referrals for support. And lastly, the applicant provides staff training on youth mental health first aid and other evidence-based techniques and approaches to crisis prevention and intervention, such as trauma responsive practices, adolescent brain development, and how to build a culture of connection. And then in subsection D, we have that by January 15th of 2025, the agency, in collaboration with the department, is to submit a report to the education committees and also the health and welfare and human services committees, summarizing the after-school programs, and you know what, we should add after-school and in-school programs to which grants were awarded, and recommending a model for the integration of mental health and in-school and after-school programming that provides consistency and reliability to children and youth, is fiscally sustainable, and does not create further workforce capacity challenges for after-school organizations, the agency, or the department.
Add schools there too, because that's just those after schools.
Yeah.
Can I ask a clarifying question, or do you want me to wait until she's done? Just in the section that you just went over with the list, there's the mandatory eligibility requirements and then the additional ones, and you said of the additional ones, they would only have to do one.
Yeah.
Where does it say that?
It's in the lead-in.
It's the lead-in.
Oh, I see, I'm sorry, I missed that.
We could say one or more, but I think one, the conversation we had early on was that there's a whole heck of a lot in here.
Yeah.
And then so dividing it up as to sort of what evidence is used, the data collection, that stuff fits in one place and the rest.
Yeah, that's fine, I just didn't see the at least one up there, so I was
Yeah,
confused.
so at least one, and it seems as if some of them would overlap anyway.
Yeah.
Okay.
Okay.
Go ahead, Kate.
So next is section 3. This section has not changed since the last time you've seen it. This directs that the Vermont Interagency After School Youth Task Force that was established by executive order is to submit to the education and health and welfare committees its bi-monthly progress reports that it's already producing on achieving expanded universal after school and summer programming. And that task force is to also provide advice and recommendations to the General Assembly upon request. We have the effective date, July 1, 2022, and renaming the title of the bill after passage to an act relating to the provision of mental health supports.
Okay, thank you. I think it's pretty clear. The big change is how the grants, are put together.
And the $4 million. Yeah.
And we have $4 million.
That's a big change.
Yeah, and the 4 million, that was a guesstimate, but I'm looking through the ESSER funds and education with Senator Hooker, Senator Terenzini. We'll see what happens. And Deputy Commissioner Boucher, thank you for being here. And we'll have some conversation hopefully in a little bit, so that'd be great to engage.
Sure, thank you.
So,
I have 2 tiny language things, but do you want me to wait?
hold on. Yeah, hold on to the language thing. We'll get to it. Let's hear from our Department of Mental Health folks. Commissioner Hawes, welcome. And Laurel Ormond, welcome. Ms. Homeland, it's good to see you both. Why don't you just tell me how you want to prepare and provide your testimony. Go ahead.
Sure. Thank you. For the record, Emily Hawes, Commissioner for the Department of Mental Health. And like you said, today I also have Laurel Omland, who is our Director of Child and Family Services for the department. What I thought we would do today is have Laurel just give sort of a snapshot of what's currently existing and go from there if you're okay with that.
Sure.
Okay.
This is your testimony.
All right, sounds good. So I'm going to turn it over to Laurel to get us started.
Thank you, Commissioner. Good morning, Madam Chair, committee members. Also for the record, my name is Laurel Omland. I'm the Director of the Child, Adolescent, and Family Unit at the Department of Mental Health, and appreciate the opportunity to talk with you all today. I do want to just lay out some broad pieces of work that we're doing that do connect with what's in this bill, and then provide some input more specifically about the bill pieces. So just to state that the Department of Mental Health, we believe all schools should be knowledgeable about child and youth mental health topics, incorporate mental health at all levels of their multi-tiered systems of support, and to do that through input from mental health experts. We believe that they should have effective protocols to screen, identify, and respond to mental health concerns, and to have in-school access to mental health supports and services, as well as protocols for linking to those community-based services. And that's not new. That is complex work that we are partnering with the Agency of Education to work through. We have Project Aware that's supporting testing out some approaches to that as well. And we welcome continued partnership with the legislature on that kind of broader goal. So as you know, school mental health occurs through different structures. There's not one structure across Vermont and how that happens. And there is clearly local decision-making in that process. So we know that schools and districts hire positions directly to focus on social emotional learning and mental health needs. They might also invite private practitioners into their building to use space to see students directly. And then many of them engage in local contracts with their community mental health or designated mental health agency under the Success Beyond 6 Medicaid program that Department of Mental Health oversees. And that's a broad program. We've talked about it before. We've talked about the history of how that came to be, the structure, the strengths, and the limitations of it. But I did want to note that when we're talking right now about where we are with the impacts of this pandemic and the needs that we're seeing across children, youth, and families in Vermont, I do believe that it goes beyond, it has tested the limitations of our Success Beyond 6 structure, as well as broader community mental health Medicaid. It goes beyond being able to be fully supported under that structure. So Success Beyond 6, I just want to note, it's a unique asset in Vermont. It does benefit those students who receive services through it. And it's as strong as the workforce that we have that's supported by it. And we also know that workforce has been quite challenged as well through this pandemic. And we're talking about addressing that through other conversations. But it's also important to note that Success Beyond 6 is limited in general to the population of students who are enrolled in Medicaid and for activities that are covered under Medicaid. And that's where the desires of what we see needs to happen and the realities of what that can offer under Success Beyond 6 kind of come to a head. We have leveraged alternative payment structures as much as we can and continue to explore how those can be enhanced to support students' mental health services. But we know it's not the entire solution that we're looking to use to address the social, emotional, and mental health needs of students, and to do so equitably across the state. I do think from the read of this bill, it has been changing and evolving. And so we've been trying to, stay on top of that this bill does recognize that there is a broader need. And I think you're trying to get to some strategies to address that. And so that's the piece that we wanted to think through. We know that education is very, very strongly supporting this multi-tiered system of supports, which I think you all are probably familiar with. And to use that language, our schools need to, as I said, incorporate the knowledge and tools and supports universally for all students. They're also trying to target those supports for students who might be at risk for experiencing mental health challenges. And this is where Success Beyond 6 tends to play more of a role. Schools are trying to figure out how to provide specific, individualized, and perhaps even more intensive services for students identified with mental health challenges. So when we talk about the full tiers, it is like, what do all students need? What do those at risk need? And what do those with identified need for supports? And how is that funded? And it is a bit of a patchwork, to be honest. And some of that, again, is driven by what currently exists at the local level within schools, and what are they pursuing for those partnerships to fill in what they don't have necessarily within their own staffing structure. So to do this well, we believe that every district should have access to a school mental health counselor or social worker, and that position isn't wholly dependent on billing for services on a set number of Medicaid enrolled students. That's the current structure right now under our alternative payment model. And it does, it does provide essential services to students, but it also challenges the ability of clinicians to really look at the whole school or targeting classroom supports. So that's an area that we, across DMH, Agency of Human Services, and our local provider system, both school representatives and mental health agency representatives, have really been doing some thinking about what is that kind of core essential mental health role and supports that are needed. And that is one area that we've been talking about. So if these funds can be used in that way to support a mental health clinician or social worker who can be available to schools, to districts, provide consultation, mental health expertise, and really think about how to structure supports and interventions at all levels of those tiers that we talked about, DMH applauds that and wants to get behind it. We also know, what we're talking about here is, I think, 2 years of funding. And the impacts of this pandemic on this generation of students is likely to go beyond that. And so we would then be talking about what's the sustainability plan for that. And just to note, Success Beyond 6 and Medicaid can't be the full plan as the stepping in afterwards. So we would need to be working closely with Agency of Education and with the legislature and the governor to do some thinking about what that could look like. But that shouldn't inhibit our creative thinking and really trying to address the immediate needs before us right now. Also, I think part of what you have in this bill is to look at policies and guidelines, and that is work that AHS through DMH and Agency of Education have been doing in a partnership with our local educators and providers. And we want to bring in some of the lessons and experiences we're having under Project Aware, through Success Beyond 6, through some of the other structures that schools have for this. And one way that we're doing that currently is we do have work groups that we're kind of capturing under a concept of Success Beyond 6 and school mental health reform. So we've really been diving into for the past I would say 2 years actually, since we had a legislative report with recommendations in 2020 to look at how can we strengthen that. And then with the pandemic kind of kicking off as we started that work, that has really honed our focus on how do we think about, as I said, those core services that are needed and how to fund it. And that's where we have come to Success Beyond 6 can, we can continue to expand and leverage as much as we can, but it can't be the full solution. I think it's challenging work, it's detailed work. We are interested in understanding what are the different roles within schools and districts that are focused on mental health. How are those currently structured? What are the, what is the scope of that across Vermont? And so what do students have access to, and where are there some gaps, and how do we address those gaps? So again, thinking about this bill that could support some of those gaps in areas of concern. It's also our understanding at DMH that Agency of Education is revisiting their recovery planning process that they had first introduced, I think last summer, and then Delta and Omicron kind of threw us off. And AOE has invited DMH to provide input into that process, and we appreciate and welcome that as well. So from our perspective, we think considerations around recovery could include things like, how do we support educators through wellness and workforce development opportunities? So we know to have effective impact on caring for students, we also need to care for the caregivers. And in this case, those are the educators. So that's a component that we really want to make sure is woven into this. We think it's also important in national school mental health guidance, point to the importance of school climate surveys. And that's some work that I know AOE had done previously, and we should do some thinking about getting to that more broadly. Universal social emotional screening can be a very strong evidence-based tool in this work and is, again, recommended nationally. And that's something that I think we should be talking more about. And then establishing guidelines for school mental health, regardless of how those positions are funded or employed, wanting to have some continuity across that and some standards. And again, that's work that we've named, but it's been challenging to really focus on and get to, given the other pressures that we're all currently experiencing, but I do want to get back onto the priority list. So with that list I just named, I don't know that this bill addresses all of those aspects, but those we do see as key parts of recovery. So to speak a little bit to, universal social emotional mental health screening, as I said, that is something that is used by many districts or states across the country. I think some of our districts in Vermont have taken it up on their own. Some of this discussion that you're having today could include consideration of funding to support districts who haven't already taken that up, and to an entity or entities who could help support that implementation so that it's effective. It's using evidence-based approaches to standing up some universal screening and protocols for what to do in response to those screening. And then, as I mentioned before, the care of the educators, care of the caregivers, I do believe, our colleagues in the school system have done amazing work. I have good friends who are in that work, and they've been, they're impacted. It is inevitable that what they have been doing has impacted their own stress levels, their own well-being. And so we know it's really important that we actually target a focus on educator wellness. And that could include something like reflective supervision opportunities with a mental health clinician who can support them in understanding what are they seeing in classrooms, what are they seeing in schools, how to respond to those effectively with students, and managing oneself in how to do that, because we can't ignore what's going on for ourselves in the midst of all this. And we also know students are impacted by how adults are doing. And so that's a key piece in a trauma-informed recovery process that we want to make sure is included. And then I'll just note, we have, again, worked with Agency of Education around some of I mentioned the need for training on mental health topics with schools. There are different structures that we have in place between AOE and DMH around training for suicide prevention for school staff, on youth mental health first aid. I think the challenge has been, while those have been offered to districts and at no cost, it's been really challenging for their staff to actually sign up and engage in those when they are holding all of the tasks that they have day to day. So I think there's interest. I don't think it's those have, hasn't been leveraged as much as we had hoped, and I don't think it's for lack of interest. I just think it's for lack of capacity at this point. So our hope is that those will continue to be the funding for those we can continue to support and have them more uptake in that in the near future. And then lastly, I know there's a piece in here around after school and the interagency after school task force that's led by the governor's office. Department of Mental Health, through myself, is represented on that task force. And there's a strong focus on how to expand access for Vermont youth to after school and summer programming to support their health and well-being. And a component of that is, how are those programs addressing the social and emotional needs of the kids, so that they can participate in those programs. So one area, and again, trying to stay up on the changing language in the bill, we just want to consider its implications. And I would say there's some concern about creating a separate but parallel process for granting funds for after school programming through this. And historically, under the Department of Mental Health, we haven't had as much of a lens on the funding or the mental health components with after-school programs. And so we just want to be thoughtful about what is the role of the department in that. Our scope has been primarily on both community-based and school-based, and where possible, I think our community mental health agencies provide some supports if it's needed in after-school programs, but there's not a clear structure for how that occurs. So I just wanted to make note of that here as well. Those are the broad pieces. I did want to note, I think the committee is aware of the recently released school mental health report card that looks at different states. And that is something that we also are noting. And I think it's important to give a nod to the data that's in there related to the ratios of mental health positions to students is actually drawing from a database that Vermont doesn't systemically use. And so I think it's not accurate. It's not an accurate reflection of who we have available for students in our schools across Vermont. That's an area that, again, Agency of Education, Deputy Boucher and myself have been interested in trying to really get a better handle on. I have the lens under Success Ground 6 of FTEs and position types across districts. Schools have a lens of who they have in their settings, but we don't have one comprehensive lens for Vermont. And so that's, again, another area of interest across AOE and DMH. It's a question of really how to do that effectively and efficiently with the current resources. So just wanted to note that as well, because I believe the committee has seen that also. That's the end of my testimony, but again, I think Commissioner Hawes and I are glad to answer other questions or clarify things as needed.
Well, thank you very much, and I appreciate your comments, in particular about teachers, because I don't know that that's fully included in the bill, but it certainly could be added as a grant opportunity in the second grouping of responsibilities. So that's very helpful. I couldn't agree more. And what would be extremely helpful is if I know everyone is overwhelmed with work right now. We have a short timeline for this bill, but if you could get us any specific suggestions about the bill. I do believe that the things that you've identified in terms of social workers and mental health counselors is included in the grants process, but if you have other recommendations, that would be great. And I also understand that in looking at the ESSER fund guidelines, there potentially could be an MOU between DMH and AOE to have the funds go directly through DMH, but we've sort of taken that off the table. It seems more realistic to have the consultation process, but I'm pleased to know how closely you're working with folks at AOE, and I suspect that Deputy Commissioner Boucher has an awful lot to do with that. I appreciate that. The report card that you talked about did identify some weaknesses in our statutory recommendations, and I don't know whether we can do everything all at once, but it would be great going forward to have recommendations from both AOE and DMH. The data there, whether the numbers are accurate, I'm looking at page 204 or 5, I forgot where it is in the report, but the increase in kids with reporting depressive illnesses is somewhat depressing. And I know it's related to the pandemic. And so we have a 2-year window maybe. This is the point I think we're trying to make in the bill is we have a 2-year window to apply these funds for educator. Now they mentioned it, it's great, and student improvements in social, emotional, and mental health issues. That I think that's where we're trying to go. And so ultimately, as I indicated early on, it's going to be a negotiation with the Agency of Education and the education committees and all of us folks trying to sort out how much money we can invest in this area, but it is absolutely critical, so. Senator Hart. No, go ahead.
I have a couple questions. I don't know, Commissioner or Ms. Olmsted, if you want to, who should answer these, but I'm wondering on page 3 of the bill, if you have the bill with you, the 3 sort of mandatory eligibility criteria. I think A and B are probably not an issue, but I'm wondering the 3 programs that are mentioned in C, the Building Flourishing Communities, Youth Thrive, and Youth Vermont, or Vermont Youth Project, are those programs you're familiar with and that you feel should be mandatory?
Commissioner, I'm glad to respond to that if you'd like. Okay. I am familiar, I would say, with 2 out of 3, unless I'm reminded about the Vermont Youth Project. There are many kind of youth initiatives in Vermont, so I'm just not exactly clear which that one is. But I do have concern about naming specific programs, or really some of this is about what are the frameworks that should be considered in this. And so Youth Thrive is certainly one that we embrace, and it's connected with the Strengthened Families, but this is a particular focus for youth. I think the concepts in there are solid. I think, again, naming Building Flourishing Communities as opposed to talking about a trauma-informed, trauma-responsive approach in recovery might be a more appropriate direction to go. And again, I'm not as familiar with the Vermont Youth Project.
Can you send
Specific.
us some language that would improve that section C?
Sure, yes.
Yeah,
I think I
that
could
would
do
be
that.
great. I mean, it's getting at trauma-informed programs that I think, are important, and so, yeah, that'd be great.
Yeah, I think that would be helpful. And then my second question is, I've been having a couple conversations with representatives from the designated agencies, and I suggested they reach out to both the agency and the department and talk to you all, because as you mentioned, Laurel, the sort of long-term funding for children's mental health, school-based mental health, the whole area is challenging by Medicaid and other funding sources. And they were interested in including some language that would look at sort of long-term stability of funding sources. And I don't know if they've reached out to you, if you know what that language is, if you're supportive or whatever, but
I'll probably do that in the budget.
if you do have it, or if you do when you speak, Heather, that would be helpful, because it would be nice to sort of, yes, this is a 2-year window, but if we can set something up for the future, that would be helpful.
Vermont Care Partners has reached out and communicated with both of us, or our 2 entities. I think in general, the concept of how can we simplify a funding structure and leverage Medicaid under Success Round 6 as much as we can is one that I think we would get behind. It's the details of how that would actually work, and acknowledging, again, as I said, kind of the limitations still within a Medicaid program for trying to get at what do all students need? How do we do this more broadly across all tiers? Those are the areas, again, that we're trying to really dig into more, as well with our partners at Vermont Medicaid also. I didn't mention before in this reform work that we are doing, but it's not a quick process.
Okay, great. But so you don't think there's anything necessary to add here? It's sort of an ongoing thing you're doing anyway, or is that what I'm hearing?
It is ongoing for what we're doing anyway. We can still take it back and consider if there are any additions that we'd recommend.
Okay, great.
Yeah,
Thank you.
there's an interim report on the work you're doing, but this is a bigger issue than I think what we're trying to accomplish in the bill. I agree with Senator Hardy. This is really important. So it could be that we'll be able to work on this as we look at the budget. Good. Okay, good question, Senator. Any other questions? All right, thank you both for being here. I'm going to turn really quickly to Deputy Commissioner Boucher from the Agency of Education. If you'd like to make a comment, or hopefully we can work together going forward on this, please. Yeah.
Yes, I feel a little, for the record, Dr. Heather Boucher, Deputy Secretary for Education. It's nice to see
Deputy
you all.
secretary,
That's
I call
okay.
me commissioner. That's
We're
not
not
appropriate.
together. Anyway, it's really nice to be here. It's nice to see you in person. It's nice to finally be able to do that. So I would say very strongly supportive of Commissioner Hawes and Ms. Omlin's testimony. We have been working very closely together on this. I think that there's a lot we can work on together in this bill. I do think we need to figure out some funding challenges. I do think it's really critical for us to be considering doing some initiatives that help our educators as an actual intervention to help our students.
Okay.
So, right, so our educators are who are spending the most time with our students.
Right.
So even if we think about after school and those kinds of potential models for doing it, I mean, who we really need to make sure is healthy and okay are our educators. And from where we're sitting, we're not seeing that coming from anywhere else. And so, yes. And so,
But give us some language.
yes,
And
absolutely.
in that second grouping, I think, or we can make it a priority for the second grouping. So that would be very helpful.
Well, we had thought of something like pretty different. So I don't know if we, one of the things we thought about was actually having a state contract that would actually provide services through telehealth or some additional ways to actually allow our educators to have, you know, confidential ability to get supports for themselves. So if we leave it as a grant, that's actually not going to be universal for all
We can
educators.
expand the bill.
Yeah,
I think, you know, it sounds like you've been thinking about this, and this is.
definitely.
Can you get us some language?
We can. I also want to state, we actually can also, so in Act 74, the $3 million, we started to do some work on that, but it's not really fully baked. So I think if we're looking for some sources of funding, we still have that $3 million.
So, and here's the thing, is it possible then that this modifies, yeah, so it looks like this would then modify Act 74 in some way.
Which would be great. And we'd
And
love to
which-
work with you on that.
Which I would, it would be great. And
Yes.
so if you could get us the language on the educator piece.
Yep.
And then whatever funding can go through the committee of education, I want to preempt the work that they're doing. So that would be terrific, because it does become a real important opportunity.
And it's a shared goal.
Yeah,
It's an
Yeah.
absolutely shared goal.
I know,
for
you've
all
been
of us.
working on this.
Thank you for calling out. It's not just me. I have a whole team that's working
Yeah, it is.
with mental health, and you know, I had we and the Agency of Education have had great partners through different commissioners and through Laurel has been the stable presence. I have to shout out to her, who has kept the foot on the accelerator.
Yeah.
So one of the other things I just want to mention too is that we do have a workforce challenge. So
Yes,
we don't have the answers for that, but I do think we need to consider that, because even if we just said we're going to have funds for clinicians in the community or even clinicians in the schools, it doesn't really solve part of the problem, which is that we don't have bodies to actually do that work.
yes.
So, and I could just go on that.
We get that, and
Yeah.
we understand that one of the challenges we're gonna have is working on workforce.
Yeah.
As, going forward, so trying to have some policies in place that would allow for that workforce to work.
Yes, in terms of flexibility and things like that. Then, one other point that I wanted to make, which is, of course I lost it. So I was talking about,
One of our challenges is workforce.
yes. I'll come back, but
Yeah.
we're on the same page. I think we're moving in the right direction. Yeah, I was thinking of something else, but it'll
You'll
come back
think
to
of
me.
it.
I will. It'll come back to me, and I can, you can certainly have me come back. I will be testifying in Senate Ed today.
This afternoon.
at 3.
Perfect, you'll think of it. And so if you wouldn't mind, please sending your language that you have to Katie McClin and to me and to Aaron, and then we'll copy Katie in, and we'll we are on an extremely fast track with this bill, so it'll be done here no later than Friday.
Okay.
So just and it's the beginning of the process. I know that there are others who will be extremely interested in it going forward.
As are we. So, great.
Thank you.
You're very welcome.
Thank you. Okay. So we've heard a lot of, this is refreshing to hear on Bill, and we'll look forward to the input that we get from Laurel and Emily and Secretary.
Can I ask a process question?
Is this bill actually going to the education committee or you?
No,
Okay,
no, it's
just
not.
the three of you are here already?
We're getting all the policy work done. The Ed committee has looked at this bill yesterday, and they're looking at the money. So we met with Sarah Clark yesterday and looked at the distribution of funds and then what might be available. That was really good to hear, that there are maybe Act 74, $3 million possible. And then it'll go to appropriations.
Okay, so we don't have to make time for education. That's what I was trying to figure out.
No,
our
yeah,
timeline.
no,
How is that gonna work?
that was,
Okay,
okay.
makes sense.
Where's Catherine? Okay. So, yeah, it's been like juggling to sort this out, but I think we'll make it.
Can I just mention one of my little language things?
Sure.
Katie?
Oh, yeah, but Katie, come on up. We're gonna do 195.
One of them I took care of with my question about those programs, because, so hopefully they'll come back with language that would help that. But the other one is on page 2, the first come, first served. Assuming that this may not even stay in the bill, but if
It does say in the bill, and I'm wondering about that.
Yeah, I think that's problematic, because where is it in there? The grants will be distributed on a first come, first served basis. Paragraph C, it's line 16. That will just prioritize all the districts that are, and the programs that are
able to do it.
more sophisticated, and the ones that really need it and are struggling will not get it. So I would just please remove that, just say.
Why don't we
programs
just
in
take that
geographically
phrase
diverse
out?
Regions.
You think you just take that phrase out?
Yeah, just take out on a first come, first served basis.
Right.
Yeah, just,
Okay.
I'm just thinking about our superintendent meeting the other day, how they're struggling in your district and they would not be able to get a grant application. Like,
Some of them would, but certainly.
Okay.
yes, exactly. Thank you.
So that's good. And then Katie, maybe can reach out to Laurel and Heather Boucher and make sure that you're getting the information that you need in a timely.
Okay, it sounded like they were going to propose some language and send it to you.
They
Okay.
will. Okay. Let's move on to 195. That one, and no one is here.
Madam Chair, would you like me to sort of do a high level overview and then just sort of drill down on the changes? Okay.
Yes, please.
So as you remember, this combines 2 bills together, the bill with regards to peer support specialists and also the peer operated respite centers. So the first section, or the first part of the bill, deals with the peer support specialists. Section 1 is a finding section. Section 2, there have been changes. You go to section 2 on page 2. I should say, I have two colors of highlighting in this draft, just to make it extra confusing. So the changes that are in the yellow highlighting are the changes that you have seen once right before the town meeting recess. And then the changes in green are the changes that were made over the town meeting recess that you haven't seen yet. So just so you would sort of have an understanding of what has changed when. That's the highlighting, and hopefully the next draft we won't need this 2-color system.
We can probably go very lightly through the yellow.
Okay.
Yeah.
So this is the peer support specialist certification program. We moved this piece into session law, and this language is about developing, contracting, or entering into an agreement with an entity to develop the certification program. So I will just move over that. We have some definitions that were moved out of the codified law and moved into the section law, so it will modify that section. And then in section 3, we have our chapter on the peer support specialists. We have a purpose section within that chapter, a definition section within that chapter, some of the definitions which you've already seen in section 2 because that is the section law piece. And then in 8503 peer support specialist certification, I'm on page 8 if that helps. This is the language about, this is sort of ongoing work that has to happen. The department has to maintain an agreement with an entity to, an entity that will do the eligibility determination to determine if individuals are eligible to do the peer support specialist certification training. And then also it would operate the training itself. And then in subsection B, an entity would be in contract with the department to do the actual certification of individuals in the program. And there's language there in the scope of duty about maintaining a public facing website that includes a roster of certified peer support specialists. And then 8504 applicants for certification. This is eligibility language, who's eligible, that hasn't changed. And then in section 8505 hasn't changed. That's the fee schedule, which basically says it has to go through the process set up in statute. Section 4 at the bottom of page 10, this is saying through AHS that you have to seek approval from CMS to amend Vermont's Medicaid state plan to include a certified peer support specialist and to allow beneficiaries self-refer. So that's the list 1 through 5. That has not changed since the last time you've seen it. Section 5, this is the actual language itself that says that peer support specialists are to be reimbursed under Medicaid. And if you remember, we have sort of like these tiered effective dates. So right away, we have the language going into effect about developing the peer support specialist program. However, this language about the Medicaid reimbursement wouldn't take effect until after the state plan amendment has happened. So we're sort of tiering this section 5 to take effect at a later date. Section 6 is the appropriation section. This has not changed since the last time you've seen the draft. So I'll pause there. That is the peer support specialist certification.
Okay.
And then we move to the peer operated respite centers. So there are more changes here. So again, this starts with the findings section. And then we have a new chapter. It has legislative intent language, definitions, many of which are mirrored in the previous chapter. And section 8553. Okay, so this language says that the department shall distribute funds to 4 geographically distinct or peer-led organizations. And then we added language that they can be health or in collaboration with a peer-run or peer-led community center. And this language would take effect, I believe, July 1, 2022. But later in the bill, we're amending this subsection A to have, I believe it's 7 centers. So why don't we just skip down to page 17, the top of page 17, that's all green, just so you can see how that piece is working. So effective July 1, 2025, we would change the 4 peer-run or peer-led respite centers to be 7. So initially only 4, and then it gets amended further down the line to be 7. So therefore, the appropriation in section 9 is only applying to the 4 centers. And fiscal year 2023, $2 million is appropriated in the general fund to DMH for the purpose of distributing $500,000 to establish and operate each peer-run, peer-operated respite center, whether operating singly or in collaboration with a peer-led community center. We get the language we already looked at in section 10, and section 11 is sort of reflects all of these tiered effective dates. So the act takes effect July 1, that's the default of this year. As already mentioned, section 5, the Medicaid reimbursement for peer certification or Medicaid reimbursement of peer certification services would take effect upon approval of the state plan amendment. And then there's a new subdivision 2 in this effective date section that says that section 10 language that moves the number of peer respites from 4 to 7 takes effect on July 1, 2025.
Questions for Katie?
Just to clarify that the 7 respite centers are new respite centers. They don't include the 2 that exist.
That's an interesting question.
Actually doesn't say that, does it?
The language is not
It
specific.
says additional peer respite centers.
Yeah, okay.
So I don't know if that's enough. I just want to make sure that it does provide it.
What, so,
Where does it say additional?
Yeah, on page, or on line 1.
I thought there's only one.
17.
Oh, that's just a header, that wouldn't be in statute.
Yeah, okay,
Yeah.
so I think we need to put something in because the original bill was for 7 new respite centers, and we know that there are 2 already in existence.
I thought there's only one.
No, there are 2, there's
there
one.
are 2.
There's
Alyssum?
one that's more Alyssum, and then there's one that's.
Sulperia, pathways, girl.
Oh, no, sorry.
So to that point, even the 4, is that 4 additional above the 2 that exist? Does that say
Yeah.
that?
No, it doesn't. I
Yeah.
didn't realize
It
we were
needs-
kind
it
of
needs to say
So it's
that.
So we
before
should say, well, you don't want to put new and
No, no,
ongoing
no.
statute. So I think
Or
maybe,
additional.
no, shall distribute funds to a total of 6 geographically distinct, And then in the appropriation section, I think you're wanting to say
9.
up to 2 million is appropriated for the purpose of distributing 500,000 to establish and operate each of the 4 new Huron. And then in section 10, we want to say, instead of 7, we want to say, let's see, what did I say? We're at 6?
9.
6, 9, okay. I'm glad you said that.
Well, no, that was good. Senator Hooker's been asking that question right along. I said, yes, no, yes.
And I guess I was confused by the header that said additional, and so I didn't know whether or not that actually.
And just for the record, in all my wealth joint fiscal office, and just to complicate things a little more, my understanding is the current, I only knew about the 1, they only get 477 a year, and then they got 26 one time. So now the new ones are gonna get more than the existing ones. So I don't wanna complicate things more, I just wanna make you mindful of, you might want them to have parity where you can either, instead of 500,000 each, you can do 477 each, or you can justify increasing the others, or some language that says, I don't know, I just want you to think about it.
How would we say that? Wait, if we want them all to have 500,000 to make it rounded up.
I think we had talked about that.
We did, but how do you say that?
Well, here's the other piece, is that the ones that don't exist right now, they're getting 500,000 in theory, it's supposed to be for startup. And I don't know if you made clear they get 500,000 annually. So 500,000 for startup, I suppose, is fine, just maybe down the road,
It's gonna have to go through appropriations.
Well, it
Yeah.
says in FY '23, they get 500,000.
Right.
And then in the new language, it says funds annually, the department shall distribute funds.
okay, well, then that's good.
You
So,
still can't bind future appropriations.
right, exactly.
Exactly.
So it doesn't say how much they're gonna get annually.
Right.
But it does say annually in the second appropriation language, but just not in the first one.
And it would apply to all of them, the existing ones and the.
Exactly. So
Okay.
presumably then they divvy it up. And there may be some that are smaller and they get less, I don't know. But to the point of what you were saying about the existing ones, so the section 9 appropriation is $2 million. Do we have to add the existing appropriation in here, or that's gonna just be in the budget?
That's base.
Yeah, okay.
That's already, yeah, that's the budget. Okay, so how long does it take to make the changes that?
I've just made them.
Oh, yes.
But now I'm having a computer problem. and I
Keep
can't
talking,
see.
Nolan.
Did we, can we,
You're welcome.
since we haven't talked about this since the beginning, before break.
Just before break, so
Look, can you just remind me who we heard from that? Does this capture all the things we talked about?
I believe it does.
We-
Check with others.
we met with
Wilder.
yeah.
Yeah, but, and also DMH, did
They've worked with DMH, I believe. I think that they're all on the same page here.
Are they? Okay.
And I know that.
We haven't heard anything.
and the OPR was okay with the changes that were made in terms of the, okay.
Yeah, I don't think OPR had.
They kind of stepped out.
concerns when, yeah.
Well, they raised concerns and then they left, so I wasn't sure if they, maybe that was.
We don't have it going through the OPR.
Yeah.
Right.
Okay.
Okay, so let's do this. We have S72, 195, 197. We'll hold 197 until we see the language, obviously. 72.
Is that the
Compact.
compact?
We have a compact and then this one. So we could do this one early in the morning. We could do 7 tomorrow, pending. 72.
Where?
Do that 30 minutes tomorrow morning.
Yeah, right, yeah, filling it up.
Send this new draft to Erin.
Huh?
Should I send the new draft to Erin?
Sure. I have the question I'm gonna ask while Katie's doing that is the committee ready to vote on S72, the compact, kids compact? Yes. And that being the case, our clerk is ready. I would entertain a motion on S72, interstate compact on the placement of children.
I would move approval.
Discussion.
What's the version, Senator Lyons?
And it's as introduced, I believe. I don't think we've made any changes. Commercial go. Out of the corner. Okay. Okay, I think Senator Terenzini, please call the roll.
Okay, I'll call the roll on S72 as introduced. Starting with myself, I'm a yes. Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy,
Yes.
and Senator Lyons.
Yes.
5-0-0.
Okay, so is there someone who would like to report on this on the floor?
It seems like a chair spell, don't you think so? Yeah.
Thank you very much. I'm gonna designate the vice chair. No, I'll do it, Karen, I'll do it, and it'll be 5-0-0, but we need to get a clean copy from Michelle Childs.
I think it's 1:30 now.
Oh, darn.
We're finished, right?
We're gonna vote on the next one.
We're gonna vote on the next.
If we can, if you're.
Okay, but no, I've just got money chairs and I'd love to eat something.
Yeah, as soon as we do have 195 posted.
From Katie, please.
Version.
It was sort of nice when I could, show my screen to everybody and
I
and have it all.
know.
Yeah.
There are network
I
benefits.
know,
Yeah,
there
there
are
are.
literally be on the same page.
Yeah, we'd be all finished with it.
The sweatpants were a benefit to
I
me.
did enjoy myself.
That shared screen yesterday.
Katie, can you send me
They were what? Yeah.
It showed they could share screen up there, but
Right.
they were up.
They can share the screen when you're on Zoom, but if you're here, Aaron could share his screen, so he could put it up.
I was thinking we might have like a plug set up here so we could plug in when we sat down.
The other trick is you could zoom in from your computer and then take over.
Yeah, you could zoom in and then cover your screen up with what you're looking at, and then when you want to zoom, you could go back. You could just leave your Zoom on.
From here?
Yeah,
Oh.
Yeah, I'm
Yeah,
zooming
just
in this
read.
afternoon, so Faith can chat with me, to tell me.
Because
Because she's,
oh, that's a good idea.
because she's home,
Oh,
so we're doing all remote.
This is really good. This is good. You'll have to let me know how it works.
We'll find out this afternoon. Ruth's in charge.
tech girl, so.
Oh, well, good.
That
Oh,
might,
good.
that might
Okay.
not go well.
We're all set to vote. We.
What is it?
There's a little bit, like, so.
Okay, she's uploading it now.
Trail's 10.3.
Okay.
Next is already on there. We'll take a minute to.
Okay.
Somebody switch my chair.
That's Josh's seat, but that.
Yeah, but that's my back chair.
Well, then take your backrest.
I will.
There's another one over here. I think that might be the seat. There's two pieces. Yeah? No.
No, mine is only one.
Okay.
I had two of them once.
My husband uses that. Thank you, Nolan.
I gotta bring my chair back.
Sweet, right.
Everybody's doing the same thing.
There it is.
Okay, here it comes. Shall we refresh then?
Yeah, it's there.
Draft 3.3.
Yes,
Did you took out the colors?
I did.
So Katie, just quickly, where did you make?
Walk me through them, yeah. So in, on page, at the very bottom of 15. So this is the language that takes effect this year. Annually, the department shall distribute funds to a total of 6 geographically distinct run or operated organizations. The next change is in section 9 at the bottom of page 16. This is the appropriation for this year. So let's see, 500,000 to establish and operate each of the 4 new peer operated respite centers.
Okay.
And then on page 17, section 10, shall distribute funds to a total of 9 geographically distinct peer run, peer led. So then we have the additional 3.
We don't need any, well, appropriations will have its hands all over this, but we don't need to qualify it anyway. But like, to the extent money is available, like.
You know what, I need an S, peer respite center. Section 9, 500,000 to establish and operate each of the 4 new peer operated respite centers. So can we call this 3.4? I've added an S to the end of centers.
On line 5?
No. I'm in section 9, line 20.
Oh, number 20, line 20.
Yeah, for the purpose of distributing 500,000 to establish and operate each of the 4 new peer operated respite centers with an S. So I'll call it 3.4 and I'll send it to,
Scribner's for sure.
I'll send 3.4 to Aaron.
But can we vote on it before?
Yeah.
Okay.
Pending change.
Pending the ask.
As long as everyone's 3.4.
Yes. Okay, any further, anything? Katie? All right. All right, so, Senator, I need a motion to, in order to move forward on this.
So that we accept draft 3.3 of S19.
3.4.
3.4, whoops, or of S19.
Oh, the S made it whole new thing.
I know, I'm sorry.
Well, that's good. Okay, discussion committee. This way I'd like to say thank you, Senator Hooker, for your work.
And Senator Lyons for your help.
All
And
right.
Katie, thank you.
Absolutely. All right, Senator Terenzini?
Okay, I'll call the roll on S-195, version 3.4, starting with myself, yes. Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy,
Yes.
and Senator Lyons.
Yes.
5-0.
Terrific. And Katie, we'll get a clean copy.
You already,
Got it.
you already
And
have it.
I'm looking at Senator Hooker.
Okay.
All right, so Senator Hooker will report this.
Okay.
Thank you.
Yay.
Thank you. I gotta go. Yeah, thanks, Ann. Well, we're off YouTube.